My name is Stuart, I'm 29 years old and I'm from Melbourne, Victoria. While I was overweight, my self-esteem was low. It was hard to be the big guy. It was embarrassing. I think I exhausted all my other options, anything we could do, nothing stuck. We would get success on something, so a 10 kilo loss here and there, but it always rose back up.
Obesity is perhaps the most common of the new breed of diseases that are chronic, that are relapsing, that are managed but can't be cured. Most people think that obesity occurs because we eat too much. But the best science doesn't support that. That misunderstanding, unfortunately, leads to stigma, which interferes with the development of new therapies and interferes with people getting access to those therapies when they are developed.
For many patients, diet and exercise have not worked for them. Diet and exercise may work to a certain limit, but they cannot go beyond perhaps 5 to 10% of their excess weight. There is a physiology for weight homeostasis, and for some patients, this homeostasis is disordered. So surgery is certainly more effective in the long term. It's very low risk, and it certainly is effective in helping them lose their weight.
Bariatric surgery changes lives. Even people who don't have many medical complications of obesity. Because of stigma, the social and financial implications of obesity are enormous. So just by dealing with those, surgery can be very effective.
When I talk to patients about when they decided to actually finally have bariatric surgery, there typically was an aha moment where they realized that their type 2 diabetes, their hypertension, their sleep apnea was going to prevent them from spending the life with their loved ones. And that's one of the insights, that if you treat obesity, you by in turn treat all these other complicating conditions. So why just treat the symptoms and not just address the root cause?
Ethicon's had a great legacy since the late 90s in the care of obesity. We know 800 million people around the world live with obesity, but less than 1% of the patient population is getting surgery. That, to me, is a big injustice.
I get to think about patients who suffer from disease like obesity and how we can make a bigger difference, not just in the devices that we develop to treat them in surgery, but to remove barriers to policy changes, to consensus guidelines, to make surgery safer and develop even new treatments to be able to make a bigger impact in their future.
Surgery was a huge success. I feel better, I look better. I live on the beach, so running my dogs on the beach is what I do for fitness. It makes me feel fantastic. I think I'm living my life to the fullest. When I look at photos of myself previously, it's like looking at a different person, and I don't want to be that person anymore, and I'm not.
We at Ethicon are rallying together with healthcare professionals, obesity societies, patient advocacy groups, and health systems around the world to raise awareness about obesity as a disease and end the stigma against people living with it. Come join us to win this fight against obesity.